Everyone. Last week there's a patient that asked me this interesting question, and her question was to know, Dr. Valerie, what has been one of the most challenging or saddest cases that you had to take care of? And I thought about it and I quickly told her the story of this little girl that came in with her parents and she when she came in she had rampant caries, meaning that she had pretty much all her teeth had been affected by cavities, and so it was so substantial that I had to refer her out to a pedodontist, which is a specialist for children, um, and they take care of teeth of children from babies on. And so for that particular patient, I knew that she was going to lose a lot of teeth, and the treatment would have been needed to be done under sedation, because the baby was actually, or the little girl was actually going to lose so many teeth. And I am very grateful that the parent, in fact, took heed of the advice that we gave them. And it was not that the parents were neglectful, but it was that they lacked information. So they didn't really know anything about cavities. They had come from um, from a country where dentistry is not necessarily a thing, or people don't really um, have the habit of going to visit a dentist. And so that was the parents background. But as soon as they came to the office and they took heed, they actually ended up going to see the pedodontist, and they followed through with all the treatment. That being said, when they came back, the this little girl that was 4 years old at the time, she ended up losing so many of her molars or her back teeth, and she only was able to have maybe a few of her front teeth that were treated, and that could be saved. So now at that age, seeming that those teeth that she lost would be replaced usually around, I'm talking about baby molars, they usually on average get replaced around 12 years old, if the child is not precocious enough. So she is going to grow up with a lot of missing teeth. At around 6 years old, that's when she's going to start having her her permanent molars coming through, us her six or the first molars, which we call 6 year molars. And so during this entire time, what that would cause her, or what she would have to be faced with, would be the fact that she has lost so many teeth. She's not going to be able to eat a lot of, food, or have a hard time eating, a lot of food. And her parents are kind of like impatient at this time, because they keep asking me, so doctor, when is she going to start having her back teeth? And as I said, and I want to stress out that it was not because the parents were neglectful, but it's because they lack information. And that's one of the reasons why we love to actually share pertinent information when it comes to or health, because some people are not necessarily not taking care of their teeth because they don't care, but it's because they lack the adequate information. So a lot of parents, come in, and when you talk to them about cavities that their children may have, they will be like, well, they're baby teeth anyway, they're gonna fall out. And that is definitely very dangerous attitude to have, because as I said, this little girl, there's a lot of her nutrition is going to be affected. Not just that, but maybe kids, they get bullied sometimes because she's has lost some of her front teeth at a early age, right? And so she could be facing maybe bullying, or some sort of self-esteem issues that she may be faced with later on, while she's waiting for her teeth. So those are some of the reasons why it's very important to understand that baby teeth are not just baby teeth, right? They actually play a role. They help the children in their nutrition. They help them in their self-esteem. They help them as far as, their pronunciation of words, right? So if you lack some teeth, there are some words that you're not able to pronounce correctly. There's so many things that teeth helps you do or help someone do, including children. They also hold a space, for permanent teeth for when they come in, so that they can come in a good manner or well aligned, right? So that's very important. And so when you have children, you definitely want to be mindful of that. Being mindful that you play the main role as a parent as far as, your children's oral health. So, what you can do is definitely make sure that you are taking good care of their teeth, that you're brushing their teeth at least twice a day, that you're very mindful at about flossing their teeth as well, because when you don't do that, children can end up having interproximal cavities, which means that you have cavities between the teeth because the bristles of the toothbrush are too thick and they're not able to get between, those teeth to really clean very well, and so you can start having cavities that way. When you take care of their teeth, you're preventing infection from occurring, with cavities, or even, some um, gum infection. um, you're helping them in that sense. You also, as a parent, want to be very mindful as far as what kind of food you are allowing or you're providing your children with as far as their nutrition. You want to make sure that you really give them nutritious food, lots of fluids as well, lots of water, but lots of fruits and vegetables. And those fruits, you want to kind of be mindful of citric food, like fruits, like for example, oranges or lemon. You want to make sure that after having given them those kind of fruits, you give them a lot of water so that you are able to, so that the water can wash out the acid that can build up on the teeth, causing decay as well, or erosion of the teeth. um so those are things that you want to be very, very mindful of. Just don't be, of that mindset that those are just baby teeth. They're not just baby teeth. They are teeth. They are helping children in so many ways. Okay, so you want to make sure that when you brush their teeth, you're brushing in a circular manner motion. You're not just brushing the surface or the enamel, but you're also brushing or aiming the bristles of the toothbrush at the gum area, right? So the area between the gum and the teeth, you want to make sure that you clean those areas very properly, because food can get lodged in there, and cavity can start developing that way as well. Okay, so I just wanted to kind of like touch up on that. You want to make sure that as far as like choosing nutritious food, you decrease um, the amount of sugar that your children intake. And that being said, you want to decrease the amount of candies and cookies and things like that, and even chips can get caked up on the teeth, and bacteria can feast on that. So it's not just sweets, it's also teeth that are really that can um, adhere to teeth, and cause bacteria to eat on that and create cavities. So you don't want to have food that gets stuck on the teeth. You want to make sure that you mirror as well, brushing and flossing yourself, especially when kids are young. They love to do what their parents are doing because the parents mean the world to them. So when you participate and you actually do it as an activity where while you're brushing, they watch you brush, and then they brush your teeth and you go after them as well, that can also help a lot. So those are kind of like some tips that I wanted to share with you parents today. Don't also forget to take your children to the dentist at least twice a year. That way, they can get the habit of coming to the dentist, and we can detect things early. If they have small cavities, we can treat them. We can provide children with maybe sealants to prevent even the formation of cavities, all those kind of treatments, right? And if we need to intervene in something early, we are able to do so. So that's what I wanted to share with you today. Your child doesn't have to have that bad outcome like that little girl did have. And if you don't have a dentist that you trust, and you are in need of a dentist for your children or even for yourself, we are Healing Wings Dental, the place where we help our patients regain and maintain their oral health and smile so that they can soar in life. And I am Dr. Valerie Mukanga, and I'm here to help you. My team and I were positioned to help you. Okay, give us a call at 972-213-0202. We are located at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas. That is in the big Dallas-Fort Worth area. And if you are not in our area, try to locate a dentist that can help your family and yourselves. Okay, so your family members and yourself. Should you have found this information to be pertinent, to be valuable, please don't hesitate to share it. Also, please subscribe to our channels. Please like our comments. If you have any questions, don't hesitate to ask them, and we'll strive. We'll do our best to answer them, okay? And that being said, we'll see you next time. You take care. Bye.